videos what I have been taking up now onwards in gynecology and obstetrics. So today's video I'll be mainly dealing with the fetal movements in pregnancy and what are they indicating. So actually during the entire course of during the entire journey of pregnancy, it has been found that when the unborn baby, that is the fetus, when your baby in the mother's womb starts kicking, it's a very exciting and a thrilling experience, and it's nomad, it cannot be described in words. Apart from this, it's a very emotional experience for certain expecting mothers. So it what does the actual meaning of fetal movements are there, and how actually the fetus is moving. So this video I'll be mainly focusing upon that in what all situations and how are the fetal movements, and how the child is going to respond in what all situations the child is going to show fetal movements. So basically the fetal movements, when the baby is inside the mother's womb, it is actually whenever the fetal movements are there, it is a clear indicator that the baby is in a very good health. And apart from this, this also indicates that the baby is increasing in size and is having the appropriate, the necessary amount of the strength. The baby is developing both in size and shape. Apart from this, he's having the enough strength so that he can show fetal movements. So as soon as early as and during the 8 to 10 weeks of gestation, the baby is now fully able to, the head is formed and the baby can rotate its heads most of the in most of the fluid in the amniotic cavity. So the baby is in the is can rotate his head during as early as 10 weeks of gestation. And when we talk of the in what in during the what time span, during what weeks of pregnancy does the fetal movements can be uh, experienced by the expecting mothers. So it is mostly seen that the women who are expecting for the first time, and if it is their first pregnancy, it is mostly seen that such women, they are due to their they are inexperienced. So just because they don't have that much of experience, so they mostly feel the fetal movements during as late as 18 to 20 weeks of gestation. Whereas the women who are who are conceiving it for the second time or the third time, so if it is their second or third pregnancy, so such women are going to experience the fetal movements. It can be as early as 14 to 16 weeks of gestation, just because they are more experienced and they can more minutely trace out that those are actually fetal movements. So most of the women who report to the clinic, they mostly say that they could feel little bit a butterfly like things which is tumbling inside their womb. They are having swishes, that swishing is there, certain rolling is there, and the tumbling of the fetuses they experience. So they also say that they feel like there's something butterfly like things are revolving around in their stomach. So basically such as the experiences. And when we look at nowadays the healthcare providers, the healthcare professionals, they are actually in the nowadays the expecting mothers are being trained to monitor their fetal movements. So because the healthcare professional, the obstetrics and the gynecologist, they cannot be with the expecting mothers throughout the entire pregnancy. So it is mostly said, it is they are mostly being, they should be taught to monitor the fetal movements during they should count the number of movements the baby kicks during what time of the day, and they should feel during some time of the day that whether the baby is kicking or not. So this is a very important thing which is to be noticed, and this noticing makes the mother, expecting mother, aware that the baby is in a good health. Now in certain situations, if the mother is not even experiencing any fetal movements up till the 28 weeks of gestation, so that indicates that there is certain kind of a fetal distress is there. There can be a risk, there can be fetal impairment as well. So Now, it has been a preconceived notion that there are certain myths also related to it. It is mostly said that during the last stages of pregnancy, it is mostly seen that the fetus is going to kick to a lesser extent, which is absolutely wrong. The expecting mother should experience the fetal kicking, that is, the quickening movements of the baby throughout the entire span of pregnancy. And it is said that a healthy baby is going to kick inside the mother's womb even when the mother is approaching the labor room. So, expecting mothers should be very well aware that it is absolutely a myth that during the later stages of pregnancy, as the due date of expected date of delivery comes, their fetus is going to kick less. It is absolutely a myth. This has not to be confused. Even the baby should kick, while it is said that the baby should even kick when the mother is being admitted to the labor room as well. So this fact needs to be cleared. Now slowly and gradually we'll be seeing that what all happens during the entire course of the journey. So basically it is seen that by the 10th week of gestation, it is mostly seen that the baby can rotate its head within the mother's womb, and now it can twist and wriggle, and he'll try to suck his thumb and show the twisting of the elbows, the jabbling of the jaws and everything. This all begins by the 10th weeks of gestation. Even he is able to open his mouth by 10 weeks of gestation. Now moving on, as the pregnancy progresses, by 13 weeks of gestation it is mostly seen that the baby, what is present in the amniotic fluid, by 13 weeks of gestation the baby is able to drink that amniotic fluid and even can perceive the taste what the mother is having through the food. So the 13 weeks of gestation, through the amniotic fluid, the baby is able to make out the taste what kind of food his or her mother is having. Moving on, as the pregnancy proceeds, the rhythm of the movements the expecting mother can feel, and if she presses her lower abdomen with the help of her fingers, she can evidently feel that the fetus is kicking in response to her pressing the abdomen. If she slightly presses her abdomen during after 28 weeks of gestation, then she can experience the kicking movement of her child. So basically, this all indicates that the baby is active and it is in a good health. Now slowly and gradually the sense organs during the later stage of pregnancy, during after 20 weeks of gestation, most of the sense organs of the baby has developed, and once the baby has gained the enough of the muscle and the bones are developed, the fatty tissue, the subcutaneous fat has developed, so the baby's hands and feet are getting strength, and even in the ultrasonography you can find the baby's hands and feet, they are constantly in motion. So this can also be seen. So even during this, once the sense organs are developed, by 22nd weeks of gestation, it is mostly said that the baby is now responsive to the light what is being falling on the uterus. So it twists and wriggles its head around in the amniotic fluid in response to light. By 33 weeks of gestation, it is mostly seen that the pupil of the baby is going to respond to the any amount of light what is entering through the abdomen, receiving it through it. So by 33 weeks the pupils, they also show responsiveness to the amount of light entering through it. They also decrease or increase in size. By 23rd weeks of gestation, actually the sense of hearing also develops. So once the sense of hearing has been developed, the fetus is now able to listen to the surroundings, and he can feel what kind of a noise and what kind of a sound he can hear. So if the mother is going to talk to that baby through her voice and make him listen certain kinds of songs or music, the baby responds to this music or sound by slight kicking, and this kicking can be experienced by the mother. Slowly and gradually, once the coordination has been established, once the proper neurological coordination has been established in the body. Now the baby is even able to put his thumb into his mouth to suck his thumb. Apart from this, he also plays along with the umbilical cord through which it is attached to the placenta. So the baby during such stages, once the proper coordination has developed, the baby even tries to, the habit of the baby tries to press his thumb near the oral cavity. Apart from this, he plays along with the umbilical cord. Now, during the later stages, as soon as the diaphragm is developed, so once the diaphragm is developed, now the baby, even he can hiccup, he can show hiccups in the mother's womb. And such expecting mothers, if they are having a constant rhythmic motion in the lower abdomen, they can feel that something is constantly moving for a period of time. So it can be related to that the baby is having certain hiccups, he is having hiccups inside the womb. So such things can also be seen. And last but not the least, in the later stages of pregnancy, as I've already said, just because the baby has grown to the full extent and there is some little amount of space for his movement, so the intensity of the movement will be less, but still the movements will persist. So with this concluding lines, I will end up this video. And students and viewers who are new to my channel, and if you like this video, give this video a thumbs up. Students and viewers, if you are new to this channel and if there are certain queries or comments, you're still most welcome to comment me in the comment section. If you like this video, give this video a thumbs up, and if you haven't subscribed the channel, subscribe the channel, and don't forget to press the bell icon so that you can be further updated for my upcoming videos. Thank you for watching.